Okay, today we'll discuss the anatomy, the lymphatic drainage of the lower limb, the abdomen, as well as the spleen. I hope the head and neck lymphatic drainage as well as the upper limb and the thorax has been covered already. So here in this lecture we'll talk about the lower limb, abdomen as well as the spleen, especially the spleen. So if you see the lymphatic drainage of the lower limb and abdomen will be mainly to the inguinal group of lymph nodes. There are very important group of lymph nodes uh, just below the inguinal ligament. This is the inguinal ligament here between the abdomen and the lower limb. Just below there is a ligament called as inguinal ligament. Just below the inguinal ligament, there are group of lymph nodes called as the inguinal group of lymph nodes. They are divided into two superficial as well as the deep. Okay, so superficial and deep are very similar to each other. So once we cover the superficial, it will be very similar arrangement will be there within the deep group also. So if you see the superficial inguinal group of lymph nodes here, okay, just below the inguinal ligament, so there will be a upper medial group and as well as the upper lateral group. Upper medial, so this is the upper and this is the lower. So in the upper medial there is this one, and the lateral will be away from the center. So upper medial group will be anterior abdominal wall below the umbilicus. So whatever region is below the umbilicus, that will be draining into the upper medial group, as well as the perineum, as well as the external genitalium, as well as the lower part of the anal canal below the pectineal line. So above will be into the inguinal group, the actually the internal iliac group of lymph nodes, and the part which is below the pectineal line in case of the anal canal, that will be to the superficial inguinal group of lymph nodes. So all these regions, that is the anti-abdominal wall, below the umbilicus, whatever region is below the umbilicus in the abdomen, that will be draining into the upper medial group, as well as the perineum, external genitalia, anal canal below the pectineal line. So what about the lateral group? So the lateral group will drain the skin of the fascia of the upper lateral side of the thigh. So this whole thing, which is on the lateral side of the thigh, that will be drained by the upper lateral group. The buttocks, as well as the flanks, as well as the back below the umbilical plane. So if we draw the umbilical plane and it continues backwards, so whatever is the region is below in the back below the umbilical plane, so that whole region, the buttocks, the flanks, as well as the lateral part of thigh, all will drain into the lateral group. Then the lower vertical group. So here is the lower vertical group. This is the lower vertical group. So that will be draining the skin and the fascia of the remaining part of the lower limb, except the lateral part of the thigh. This lateral part will be draining into the lateral upper group, and so the vertical group will be draining the remaining part of the whole of the skin and the fascia of the lower limbs. So all these superficial lymph nodes finally drain into the deep inguinal group as well as the external iliac group of lymph nodes. So finally, even though these are the superficial inguinal group of lymph nodes, that will be draining into the deep inguinal group of lymph nodes as well as the external iliac group of lymph nodes. So what about the deep inguinal group of? I said the arrangement of the lymph nodes will be similar to that of the superficial group of lymph nodes. So the same upper medial group as well as upper lateral group as well as the lower vertical group will be present within the deep inguinal group of lymph nodes also. So these that drains the superficial. This deep group of lymph nodes will drain the superficial, as we already seen, the superficial inguinal group of lymph nodes, along with the popliteal group of lymph nodes, the glans penis, as well as the deep lymphatics of the lower limb. So whatever region is below deep to the deep fascia, so all these regions are drained by the superficial, the deep group of lymph nodes, along with the superficial group of lymph nodes. Whatever is superficial to the deep fascia, that will be drained into the superficial group of lymph nodes. So whatever is deep to the deep fascia, that will be drained into the deep inguinal group of lymph nodes. Finally, even the superficial will drain into the deep inguinal group of lymph nodes. So all the deep nodes finally into the external ilia group of lymph nodes. So the arrangement is superficial inguinal group of lymph nodes will drain the most of the parts of the lower part of abdomen, the lateral part of the skin, perineum, everything. Then they drain into the deep inguinal group of lymph nodes. Deep inguinal group of lymph nodes also drain the lower limb. And then finally they all drain into the external ilia group of lymph nodes. External group of lymph nodes. So here you can see behind the knee. So behind the knee will be the popliteal group of lymph nodes in the popliteal fossa. And here this region is the region where the inguinal group of lymph nodes are present. So the popliteal group of lymph nodes, they are seen in the popliteal fossa, which is in the back of the knee. So even though it is shown in the front, actually it is in the back of the knee. Okay, here in this region. So this is called as the popliteal fossa. Within the popliteal fossa, you can see the popliteal group of lymph nodes. So what is the drainage area for this group of lymph nodes? They drain the part of the limb distal to the fossa, whatever is the region below that. So that is the leg as well as the foot. So all these are drained by into the popliteal group of lymph nodes. From there they drain into the inguinal group of lymph nodes. Okay. So this is the lymphatic drainage of the lower limb. Now coming to the lymphatic drainage of the abdomen, as we have seen, the skin, fascia, and the abdominal wall will be draining into the superficial inguinal group of lymph nodes. So, what about the deep? The abdominal organs and other deep structures drain into. There are group of lymph nodes around the aorta. This is the aorta here. Beside the aorta, there are group of lymph nodes. There are group of lymph nodes in front of the aorta. So whatever is in front of the aorta, these are called as pre-aortic group of lymph nodes. In front of the aorta, the pre-aortic group of lymph nodes. Those group of lymph nodes which are on the sides of the aorta, those are called as para-aortic. Para means beside, pre means in the front. So they will be draining into the pre-aortic group of lymph nodes or into the para-aortic group of lymph nodes, or if you go down here, the abdominal aorta divides into the common iliac. So there will be group of lymph nodes. These are called as the common iliac group of lymph nodes. These common iliac arteries will divide into the external and internal. So similarly, the group of lymph nodes which are around that external and internal iliac arteries will be called as internal and external iliac group of lymph nodes. So there are pre-aortic group of lymph nodes on the top in front of the aorta, para-aortic group of lymph nodes on the sides of the aorta. Then the aorta divides into common iliac artery. So there will be common iliac group of lymph nodes. Then the common iliac will divide into the external and internal iliac. So those group of lymph nodes around that part of the arteries will be called as the external and internal iliac group of lymph nodes. So all these group of lymph nodes will be draining most of the organs of the abdomen. All the organs of the abdomen will be draining into either of these group of lymph nodes. Especially the pelvic group of lymph node, pelvic organs will be draining into the common iliac or external and internal iliac. Then those organs which are in the abdomen will be draining into the pre-aortic or para-aortic group of lymph nodes. Now coming to some special arrangement of lymphatics within the abdomen, especially in case of the intestines. Okay, especially in the mucosa of the intestine. Okay, so the GIT is potential portion of the infection, because whenever we eat food, lot of bacteria, viruses, everything will be present. So it is the potential site of infection, the gastrointestinal system, and hence protection by aggregation of lymphocytes forming lymphoid follicles known as gut associated lymphoid tissue, that is called as GALT, gut, or sometimes it is also called as the mucosa associated lymphoid, because they are present in the mucosa of the wall of the intestine. Okay, so they are called as the mucosa associated lymphoid tissue or gut associated lymphoid tissue, GALT or MALT, MALT, mucosa associated, especially in the esophagus, small intestine, as well as large intestine, and especially in the last part of the small intestine, that is the ileum and the appendix, where there are huge aggregation of the lymphocytes. Okay, so especially in the wall of the intestine, in the lamina propria as well as the submucosa. of the ileum, the last part of the small intestine, contains aggregation of the lymphoid nodules known as Peyer's patches, especially in case of the last part of the intestine, small intestine in the ileum. There the huge aggregation of lymphoid follicles. If you see here, so these are the huge aggregation of the lymphoid follicles, and these are called as Peyer's patches. They are seen even with a hand lens. So these are called as Peyer's patches. These are very important, especially in case of the typhoid fever, where they get actually inflamed, and it leads to sometimes even lead to perforation. Okay, so these Peyer's patches are very important, which are nothing but the aggregation of the lymphoid follicles, lymphoid nodules. Okay, around 30 patches are seen in case of the humans. There are around 28 to 30 patches seen in case of the ileum of the humans. Each patch consists of 10 to 200 nodules seen with naked eyes. So it is nothing but the patches and nothing but the huge aggregation of the lymphoid nodules, 10 to 200. So many nodules come together and they can be seen with the naked eyes, especially when you use the hand lens. So these are called as Peyer's patches. So the Peyer's patches appear as dome-shaped area devoid of villi. If you see here, you might have studied or you will be studying more in detail in histology as well as pathology, how they exactly look like. Okay, so they will be seen as dome-shaped areas devoid of villi. These are finger-like projection called a villi. So these villi are absent where the patches are present, and covered by epithelium consisting of M cells, and the cells which are covering this part of the Peyer's patches will be called as M cells. They are not absorptive cells. So that is the important part of the lymphatic system, which is seen in the intestine, especially in the ileum as well as the appendix. Now coming to one important organ in the abdomen, which is a very important component of the lymphatic system, that is the spleen. Spleen is also called as lineo in case of Latin and spleen in case of the Greek. Okay, so this is the largest single mass of hemolymphatic organ. Okay, because in the early stages it also produces the RBCs in case of the fetus. So that's why it is called a hemolymphatic. It is a lymphatic organ in the body belonging to the reticuloendothelial system. So it belongs to the reticuloendothelial system. The location of this spleen is beside the to the left of the stomach. So this is the side. So it is present in the left hypochondrium, as well as slightly sometimes it will invaginate into the epigastrium. So if you see this, it is wedged between the fundus of the stomach and the diaphragm. Here is the diaphragm and the fundus and the body of the stomach. If you see here, this whole thing is the spleen, which is behind the stomach as well as to the left of the stomach, and it is wedged. It is held between the fundus of the stomach and the diaphragm. This is the diaphragm here and the fundus of the stomach. So in between is the spleen. So if you see the shape of this spleen, it is almost wedge shape, or it is also called as tetrahedral. Okay, so this is the shape of the spleen. So if you see the size and weight, it is remembered with a dictum called as the Harris dictum, which is 1357 and 911. 1357911. What is this? One, it is 1 inch thick. If you see the spleen, it will be 1 inch thick, and it will be 3 inches in breadth, and it will be 5 inches in length. So it is 1 inch inch into 3 inches into 5 inches. Okay, that is the size of the spleen. Then if you see the weight, it will be around 7 ounces in weight. Okay, and it will be between the ninth and 11th rib. Okay, okay, so it is sitting on the 10th rib, between the ninth and 11th rib, and it is in the same plane as that of the ribs. Okay, okay, so this is the Harris dictum, 13579 and 11. So 1 inch in thickness, 3 inches in breadth, and 5 inches in length, 7 inches in weight, and 9 to, it is related to the ninth and the 11th. It is between the ninth and the 11th rib. Position or the axis of the spleen, I said it is in the same direction as that of the ribs. Lies obliquely along the axis of the 10th rib. So it is be sitting on the 10th rib and it will be along the same axis of the 10th rib, 9th rib as well as the 11th rib. And it will be between the 9th and the 11th rib, sitting on the 10th rib, and makes an angle of 45 degree with the horizontal, because the ribs are also at an angle of 45 degree. So even this spleen, because it is in the same direction as that of the ribs, so that will be also at an 45 degree angulation compared to the horizontal. So it is directed downwards, forwards and lateral. If you see here, this is how it is present. Here also in this picture, if you see, it is obliquely placed at an angle of 45 degree. So it is directed downwards, forwards as well as laterally. Okay. Now coming to the some external anatomical features of the spleen. What do you see anatomically? So if you see, it is a soft, highly vascular and dark purple in color. This is the usual color of the spleen. It is dark purple in color. It is highly vascular, okay, because it has lot of blood vessels, and it is soft in nature because there is no any bone in that organ. So it will be soft in nature. It has two ends. Okay, one is called as the anterior end. Okay, so if you see here, this is called as the anterior. This is the normal actual position of this spleen, and here will be the stomach sitting here. Okay, so this will be called as the anterior end. Okay, and the posterior, this is the posterior end. So anterior end is lateral and the posterior end is it is medial. Okay, so these are the two ends of the spleen, anterior and posterior. Okay. Then if you see the borders, there are three borders. One is called as the superior border, this border here. This is called as the superior. This is a very important border because it shows notches. Notches, what are these notches? These are nothing but the developmental feature of the spleen. Initially the spleen will be in the form of lobules which fuse together. During the fusion, still there is incomplete fusion and these notches will be present. This is present only in the superior border. So whenever we palpate the spleen, at that time this is the border which we feel. So whenever you feel the spleen, try to feel the notches. This confirms that this is spleen. So this clinically, this border is very important because whenever you feel if there is enlargement of splenomegaly, if there is enlargement of the spleen, so at that time, whenever you feel the spleen, it is because of the superior border, this border. And whenever you feel the superior border, try to feel the notches. So this confirms that this is the spleen. It is not any other organ. So the superior border will have notches, and the inferior, and then there will be the intermediate border. Then if you see here, this is called as the inferior border, and this will be the intermediate, or this will be called as the intermediate border. So this is the superior border, this is the inferior border, and here will be the intermediate border. Then it has two surfaces. This surface where it is in contact with the organs, this is called as the visceral surface, and this smooth surface which is in contact, which will be behind, so which will be in contact with the diaphragm, that will be called as diaphragmatic surface, which will be convex and smooth, and the visceral surface will be rough, irregular. Okay, and you can see in the center there will be a site where the structures will be entering or coming out. That will be called as the hilum of the spleen. Now coming to some of the important relations, visceral relations to the spleen. Okay, so it has two surfaces as we saw, diaphragmatic surface and the visceral surface. Visceral surface will show the visceral impressions. Diaphragmatic surface will be in contact with diaphragm, so it will be smooth and no any other organ, so there is no visceral impression there. But visceral surface will show impression for many structures. So it gives four impressions. One is the fundus of the stomach. So if you see here, this part will be in contact with the fundus of the stomach. So as we saw, it is wedged between the fundus of the stomach and the diaphragm. So fundus of the diaphragm will give you impression here on the top. This is called as the gastric impression. Then we have the anterior surface of the left kidney. So there will be the renal impression on this part. So this is called as the impression, renal impression here. So here will be the gastric impression. Here will be the renal impression. Then below we have the splenic flexure of the colon. So if you see here, this is the colon, and this is the splenic flexure of the colon. Here is the spleen. So this splenic flexure also gives an impression here. This is called as the colic impression. Then the tail of the pancreas, if you see here, this is the tail of the pancreas, goes all the way and it comes and approaches the hilum of the spleen. So it is in very close contact with the tail, the hilum of the spleen. This is very important relation, because if there is splenectomy, usually whenever there is trauma to the abdomen, it will be the spleen which will rupture, or rupture of the spleen. So it will be severe, bleeding will be taking place. So if you want to bleed, sometimes you have to do the splenectomy. So when you do the splenectomy, you should be very careful about the tail of the pancreas, because the tail of the pancreas will have the highest number of islets of Langerhans. And if you surgically cut during the splenectomy, that it leads to the induced diabetes, because you are cutting the tail of the pancreas. So you should be very careful when you are doing the splenectomy. So this is a very important relation. If you see here, this will be the tail of the pancreas coming in close contact with the hilum of the spleen, with the hilum. This is the diaphragmatic surface. This is the visceral surface of the spleen. Now coming to the some peritoneal relations of the spleen. It is completely covered by the peritoneum. The spleen is surrounded on all sides by the peritoneum, and it is suspended by the following ligaments. So it is held in its position by the following ligaments. Which are those? One is the gastrosplenic ligament. There is a ligament running between the stomach and the spleen, that is called as the gastrosplenic ligament, the fundus of the stomach and the spleen. Then linorenal ligament. Then the second is between the spleen and the kidney. So there will be linorenal ligament. The third, which is the important ligament, that will be called as the phrenicocholic ligament, between the phrenic means diaphragm, which will be holding the spleen in its position. Okay, between the spleen and the diaphragm. Among these, the renal ligament contains the tail of the pancreas. So this is a very important relation, because whenever I said, when doing the splenectomy, you will be cutting this renal ligament, so which also contains the tail of the pancreas. So you should be very careful when you are cutting the renal ligament, as I said, because it will cut the tail of the pancreas. Now coming to so here again you can see this is the tail of the pancreas in relation to the hilum of the spleen. Now coming to the blood supply. The spleen is supplied by the splenic artery. If you see here, so this is the very zigzag artery which runs above the upper border of the superior border of the pancreas. This is called as the splenic artery. Okay, so it will be supplying the spleen. That's why it is called as splenic artery. Along with that, it also supplies the pancreas as well as stomach, many important structures. Okay, but it is called as the splenic artery, and it supplies the spleen, which is tortuous in course. As you can see here, it is not straight but tortuous in its course, and passes through the linorenal ligament. So any structure has to pass into the spleen, it has to pass through the linorenal ligament to reach the hilum of the spleen, where it divides into 5 or more branches before entering. If you see here, this splenic artery will divide into 5 or more branches, each branch going to the each lobule of the spleen. So that's why it divides into multiple branches before it enters the hilum of the spleen. So this is about the splenic artery. Splenic artery is a branch of the celiac trunk. Here is the celiac trunk, so that is a branch from the celiac trunk. Now coming to the venous drainage. Venous drainage is also named by the similar vein called as the splenic vein. If you see here, this is the spleen, this is the splenic vein coming here. Okay, which joins the superior mesenteric vein. So it joins with the superior mesenteric vein to form the portal vein. If you see here, this is the superior mesenteric vein, this is the splenic vein, joined together to form the portal vein. So splenic vein is a very important vein which will help in the formation of a very important vein called as the portal vein. And what you are seeing here, this is the inferior mesenteric vein, which also drains into the splenic vein before The splenic vein joins with the splenocentric vein. Coming to the nerve supply, it will be by the sympathetic fibers derived from the cilia plexus, which are vasomotor to the spleen. Okay. Now, finally, coming to the development of the spleen. As I was telling, the spleen will be lobulated initially, so it starts developing in the 6th week of intrauterine life. At a very early stage, the development of the spleen starts. Actually, it is identified. Okay, and it starts developing at a very early stage of the 6th week of intrauterine life. From the cephalic part of the dorsal mesogastrium, from its left layer, you might have studied the cephalic part, the dorsal mesogastrium, as well as the ventral mesogastrium. Ventral will be in the front, dorsal will be behind. Okay, from its left layer. Initially, it will develop into a number of nodules. As I said, nodules will be there, or lobules will be there, which later fuse. Hence, we see notching of the superior border of the adult spleen. Okay, so this is the reason when we see, as I told before, that the superior border will show notches. So, which is clinically very important to identify that this enlargement in the abdomen, what you are feeling is from the spleen or from some other organ. Now coming to something called as accessory spleens. Sometimes we have accessory means what? It means additional. So sometimes there can be additional spleens, or they are also called as the spleniculi. Whenever there will be additional spleens, they are called as the spleniculi. So what are these additional spleens or the accessory spleens? It appears when splenic nodules fail to consolidate in the embryo. As I said before, there will be multiple nodes or lobules which will later fuse. Sometimes one or two lobules will fail to consolidate, okay, fail to join the main organ. So at that time, there will be development of the accessory spleen, or which is called as the spleniculi. Okay, in case of in the embryonic stages. These accessory spleens or the spleniculi can be seen sometimes in the broad ligament of the uterus. Okay, broad ligament of the uterus is a peritoneal fold which is in the pelvis beside beside the uterus. So there is sometimes you can see the accessory spleen. They have been traced that there are cases where there are uh, uh, the uh, the researchers have found that the spleen is a part of the spleen, or the accessory spleen is present in the broad ligament of uterus. Sometimes it is also seen in the spermatic cord in case of the males. Okay, spermatic cord. They have traced some kind of spleniculi or the accessory spleen. Sometimes they are also seen in the gastrosplenic ligament. Gastrosplenic ligament, sometimes in the linorenal ligament. So linorenal ligament is the same ligament where the pancreas is present. Okay, and sometimes the part of one lobule might get separated. Okay, so if you see here, these are the spleniculi here, accessory spleens, which are seen in the linorenal ligament. Sometimes they are also seen in the gastrophrenic ligament, or sometimes in the greater omentum. So these are all the sites where you can see the accessory spleens. What are accessory spleens? They are nothing but the unfused lobules of the spleen, okay, or the nodules of the spleen, which are called as the spleniculi. Usually they are seen in the broad ligament of uterus in case of female. They are seen in the spermatic cord in case of the male, and sometimes in both these genders, they are seen in the gastrosplenic ligament, sometimes in the linorenal ligament. As the picture shows here, these are the linorenal ligament spleens, accessory spleen. Sometimes they can be also seen in the gastrophrenic ligament and the greater omentum. So this is all about the spleen, as well as the lymphatic drainage of the lower limb, as well as the lower part of the abdomen and the perineum. So if you have any questions regarding this, you can ask me now.
Thank you, Doctor.
Thank you, doctor.
Yeah, that's
Okay, thank you very much. So if you don't have any questions,